Imagine waking up one morning feeling just slightly off, a faint ache in your bones, a subtle scratch in your throat, and you think it's nothing, just a passing cold, just another tired day. But as the hours creep by, your body begins to betray you in ways that feel unrelenting and insidious. Your head pounds with a heaviness that makes every movement unbearable, every breath shallow, every glance at the clock a reminder of how precious time suddenly feels when your energy is stolen. You try to push through, ignoring the chills that rattle through your chest and spine, dismissing the mounting fatigue that drags at your limbs like invisible weights, but it only intensifies, as if some unseen force is slowly taking control, draining your vitality and making you acutely aware of the fragility of the human body. There is a cold sweat on your forehead, your heart races in a silent panic you cannot quite explain, and you realize with a creeping sense of dread that this is no ordinary discomfort. The sneezing, the coughing, the sudden shivers, each a subtle signal from something far more powerful than you imagined, a disease that lurks quietly in the background of your daily life until it strikes with a sudden, ruthless force. And yet, outside your window, the world continues on, unaware, indifferent, while inside you feel the creeping pressure of your own vulnerability, the terrifying notion that your strength, your routines, your plans, your very sense of self are suddenly at the mercy of something microscopic, invisible, and relentless. Every cough echoes with an unfamiliar weight, every ache feels amplified, every thought spirals toward the what-ifs you didn't dare consider. What if it spreads silently to those I care about? What if it lingers longer than I expect? What if it overwhelms me when I least anticipate it? The mind races as much as the body rebels, a cruel partnership between fear and physical distress, making each passing moment feel heavier, more urgent, more impossible to ignore. And there is a subtle, almost imperceptible guilt that presses on you too, the idea that by existing in this modern, interconnected world, you are a potential vector, a living bridge for an invisible enemy that respects no borders, no schedules, no plans. The flu is not something that waits politely. It invades quietly, patiently, and then manifests with a ferocity that can leave even the healthiest feeling powerless. A stark reminder of how vulnerable we are despite our technology, our knowledge, our sense of control. The more you try to focus on work, on conversation, on anything at all that feels normal, the more the body insists on being acknowledged, demanding attention through waves of exhaustion, shivering chills, sudden sweats, and a pervasive sense of malaise that cannot be soothed by distraction or denial. Every sensation becomes amplified, every heartbeat a drumbeat of caution, every breath a reminder that something unseen has stepped inside your life and refuses to be ignored. And as the day drags on, you begin to realize just how pervasive and insidious this silent adversary can be, how easily it can unsettle routines, relationships, and responsibilities, how subtle at first yet unstoppable in its persistence, how utterly ordinary moments can be hijacked by a microscopic organism that turns the familiar world of comfort and security into a strange, uncertain terrain. It is that creeping sense of fear, that urgent awareness of your own fragility, that compels a realization that this is not merely an inconvenience, not a passing annoyance, but a disease that demands respect, attention, and understanding. Every glance in the mirror, every cough, every shiver becomes a small alarm, a call to consciousness that life, as you know it, can shift in the blink of an eye, and that ignoring the warning signs can have consequences you may not yet comprehend. The flu is patient, silent, and unrelenting, and the moment you feel that first twinge, that faint discomfort, the clock starts ticking in a race you cannot afford to lose. When we talk about influenza or the flu, it's important to really understand what this disease is and why it matters so much to our health. Influenza is a viral infection that primarily targets the respiratory system, your nose, throat, and lungs, but its effects are not limited to just those areas. The virus itself is tiny, invisible to the naked eye, yet it has the remarkable ability to move quickly from person to person, silently finding its way into communities, workplaces, and homes. Think of it as an uninvited guest that can enter without warning and disrupt your entire body, often before you even realize anything is wrong. Influenza is not just a simple cold. While a cold might make you feel congested or slightly tired, the flu tends to hit harder, bringing an array of symptoms that can be sudden and intense, making your body feel like it's under siege. The virus triggers your immune system to respond aggressively, and that response can leave you exhausted, achy, and feverish. Every joint may feel sore, every muscle tender, and even the lightest movements can seem overwhelming. But it's not just about the discomfort, it's about the way this disease can change the rhythm of your daily life almost instantly. The flu can make routine tasks like getting out of bed, preparing a meal, or even speaking for long periods feel impossible. You might find yourself in a constant battle between wanting to push through and recognizing that your body is demanding rest, reminding you of its limits. What makes influenza especially concerning is its ability to evolve. The virus mutates frequently, which is why it can return each year in a slightly different form, making it possible to catch it multiple times in your life. This also means that the body doesn't always recognize it immediately, and the immune system has to adjust and fight all over again. For some people, particularly those with weaker immune systems, the elderly, or individuals with chronic health conditions, influenza can become far more than an inconvenience. It can lead to serious complications, making it essential to respect its potential severity. Understanding what influenza is also means recognizing its role in the broader context of public health. Each infected person has the ability to transmit the virus to many others, often before even realizing they are sick. This silent transmission is part of what makes influenza so pervasive and why outbreaks can spread rapidly through schools, offices, and neighborhoods. It's a reminder that this disease isn't just about individual symptoms. It's about communities and the ways in which a tiny virus can ripple outward, affecting countless lives. Knowing what the flu is, how it behaves, and why it can be so disruptive helps us approach it with the care and attention it demands. It's not meant to scare you unnecessarily, but to help you respect its presence, listen to your body, and take proactive steps to manage your health and protect those around you. Recognizing influenza for what it truly is, a powerful, adaptable viral infection that can affect anyone, allows you to stay mindful, cautious, and empowered in your daily life, even when it's not immediately visible. By understanding the disease in depth, you are already taking the first step toward being prepared and resilient, acknowledging its impact while maintaining hope and control over your well-being. When we talk about what causes this disease, it is important to understand that illness rarely comes from just one single reason. In many cases, it develops slowly because of a combination of factors that build up over time, sometimes without a person even realizing it. One of the most common causes is the way our body responds to harmful germs, such as viruses, bacteria, or other tiny organisms that enter through the air we breathe, the food we eat, or even through close contact with someone who is already sick. But causes are not always limited to infections. Sometimes the problem begins from within the body itself, especially when certain organs stop working the way they should. This can happen because of poor lifestyle habits, weak immunity, long-term stress, or not getting enough rest. For example, when the body is constantly tired and not given proper nutrition, it becomes less able to protect itself, making it easier for disease to take hold. Over time, small weaknesses can turn into bigger health problems. Another important factor is family history. If certain conditions run in a family, a person may have a higher chance of developing the same issue, not because it is guaranteed, but because the body may already carry certain tendencies. Environment also plays a very strong role. Living in polluted areas, breathing unclean air, drinking unsafe water, or being exposed to harmful chemicals can slowly damage the body. Even daily habits like smoking, eating unhealthy food, or avoiding physical activity can quietly increase the risk. Many people do not feel the effects right away, which is why the disease can grow silently for months or even years before showing clear signs. Emotional health is another cause that people often ignore. Long-term anxiety, sadness, and mental pressure can weaken the body's natural defenses. When the mind is under constant stress, the body releases certain chemicals that can disturb normal balance and make a person more vulnerable. Age can also be a factor because as the body grows older, it becomes less strong in fighting off illness. Children and older adults are often more sensitive because their immune systems are either still developing or slowly weakening. Sometimes the disease may even start after an injury or a long period of neglecting small health problems. A minor issue that is ignored again and again can slowly turn into something more serious. It is also important to understand that in some cases, a person may do everything right and still become sick because life and health are not always fully in our control. The key thing to remember is that causes are usually a mix of physical, emotional, environmental, and sometimes genetic factors working together. Understanding these causes helps people become more aware of their bodies and take better care of themselves. When someone learns what might lead to illness, they can begin making small changes that protect their health in the long run, and that awareness is the first gentle step toward healing and living a safer, stronger life. When it comes to understanding the symptoms, I want you to imagine your body as a messenger that is constantly trying to communicate with you. It whispers first, very softly, and if we ignore those whispers, it starts speaking louder. In the early stage, many people feel something small and easy to dismiss, maybe a sudden wave of tiredness that feels heavier than normal, or a slight chill in the body even when the room is warm. Some notice a scratchy or uncomfortable feeling in the throat, while others may experience a mild headache that feels different from their usual stress-related pain. These early signs often seem harmless, and that is why so many people continue their daily routine without slowing down. As the illness begins to settle in, the body's temperature may rise, leading to fever. Fever is not just heat, it is your body's defense system working hard to fight what it sees as a threat. Along with this, many people feel deep body aches, especially in the muscles and joints, almost like the soreness after intense exercise, but without having done any physical activity. There may be chills that make you shiver under a blanket, followed by sweating as the temperature shifts. A dry or persistent cough can develop, sometimes gentle at first, but gradually becoming more uncomfortable. Some people feel pressure around their eyes or forehead, a heavy sensation in the head that makes it difficult to concentrate. Fatigue often becomes overwhelming, not the kind that disappears after a short nap, but a deep exhaustion that makes even simple tasks feel difficult. You may find yourself wanting to lie down most of the day, feeling drained without understanding why. Appetite can decrease, and food may not taste or feel appealing. In some cases, nausea or mild stomach discomfort may appear, especially in children. Breathing might feel slightly harder if congestion builds up, and the chest can feel tight or irritated. What is important to understand is that symptoms can vary from person to person. Some individuals experience them strongly and suddenly, while others feel them gradually over a few days. Children may become unusually quiet or irritable. Older adults might not even show a strong fever, but may appear confused or weaker than usual. This is why paying attention to small changes in behavior and energy is so important. Sometimes people think they just have a common cold because the early signs can seem similar, but the difference often lies in the intensity. The symptoms here tend to come on faster and feel more severe, almost like the body is suddenly overwhelmed. As the days pass, the peak of symptoms usually occurs within a few days, and then slowly, the body begins to recover if no complications develop. However, if breathing becomes very difficult, chest pain appears, or extreme weakness continues, that is a sign the body needs immediate medical attention. I always tell my patients to listen carefully to their bodies and not compare themselves to others, because every immune system responds differently. Recognizing these symptoms early allows you to take the right steps at the right time. Your body is not your enemy during illness, it is fighting for you. Treat it with patience, rest, and awareness, and never hesitate to seek help if something feels more serious than usual. Prevention is always kinder, easier, and safer than dealing with the illness after it takes hold. And I want you to think of prevention not as a difficult task, but as a gentle daily habit that protects you and the people you love. The first and most powerful step is simply being aware that this illness spreads easily from one person to another, especially in crowded places, closed rooms, or during seasons when many people are already unwell. That means small, mindful actions in your everyday life can make a big difference. Washing your hands regularly with soap and water is one of the simplest ways to protect yourself. It may sound too basic, but our hands touch so many surfaces throughout the day, and they can carry germs to our nose, mouth, and eyes without us even realizing it. Keeping your hands clean creates a strong barrier between you and infection. Another important habit is being careful around people who are already sick. This does not mean avoiding them with fear, but gently maintaining distance, especially if someone is coughing or sneezing frequently. Covering your mouth and nose when you cough or sneeze, even when you are healthy, is also a sign of care and respect for others around you. Your body's strength also plays a big role in prevention. When your immune system is strong, it can fight off infections more easily. This strength comes from simple daily choices like getting enough sleep, eating balanced meals, drinking enough water, and giving your body time to rest when it feels tired. Stress and exhaustion can quietly weaken your body's natural defense, so taking time to relax, breathe, and slow down is not a luxury. It is a form of protection. Fresh air and a clean environment also help reduce the chances of illness spreading. Opening windows, keeping rooms ventilated, and maintaining general cleanliness in your living space can make a noticeable difference. During certain times of the year when illness spreads more easily, taking extra care of yourself becomes even more important. Wearing a mask in crowded or enclosed spaces can offer added protection, especially if many people around you are unwell. There is also the option of vaccination, which helps your body prepare itself in advance so it can recognize and fight the infection more effectively. Many people hesitate, but speaking with a healthcare professional can help you understand what is right for your age, health condition, and lifestyle. Prevention is not about living in fear, it is about living with awareness. It is about making small, loving choices every day that quietly guard your health. When you protect yourself, you also protect your family, your children, and even strangers around you. These simple actions, repeated daily, create a shield that keeps you stronger and safer. I always remind my patients that your health is your greatest wealth, and taking a few moments each day to care for your body can prevent days or even weeks of suffering later. Please take these steps seriously, not with worry, but with care and responsibility. Stay mindful, stay protected, and if you found this guidance helpful, share it with someone you care about, because one small act of awareness can protect many lives. When it comes to treatment, the most important thing I want you to understand is that your body already knows how to fight this infection, and our goal is to support it, not rush it. In many healthy adults, this illness improves within several days to a week, with proper rest and care at home. The first and most powerful treatment is simple but often ignored, and that is rest. Your body needs energy to fight the infection, and if you continue pushing yourself, going to work, staying up late, or stressing your system, recovery becomes slower. Giving yourself permission to slow down is not weakness, it is smart healing. Along with rest, staying well hydrated is extremely important. Fever and sweating can cause fluid loss, and dehydration can make you feel even more weak and dizzy. Drinking water, warm soups, herbal teas, and clear fluids helps your body stay balanced and supports recovery. For fever, body aches, and headaches, common over-the-counter medicines can help reduce discomfort. These medications do not cure the infection itself, but they make you feel more comfortable while your immune system does its job. It is always important to follow proper dosage instructions, and, if you have other health conditions, to check with a healthcare professional before taking anything new. In some cases, especially if treatment begins early, doctors may prescribe antiviral medication. These medicines can reduce the severity and shorten the duration of the illness, particularly in people who are at higher risk of complications, such as older adults, young children, pregnant women, or those with chronic health problems. However, antibiotics are not helpful unless there is a clear bacterial complication, because this illness is caused by a virus, not bacteria. Misusing antibiotics can create other problems, so they should only be used when truly necessary and prescribed by a doctor. Comfort care at home also plays a big role. Using a humidifier can ease dry cough and throat irritation. Gargling with warm salt water may soothe throat discomfort. Eating light, nutritious meals when you feel able helps your body regain strength. Even if your appetite is low, small portions of healthy food can make a difference. Monitoring your symptoms carefully is part of treatment too. If you notice breathing difficulty, persistent high fever that does not improve, chest pain, confusion, or extreme weakness, these are warning signs that require immediate medical attention. Early medical support can prevent serious complications. For children and older adults, extra care and close observation are very important because their bodies may react differently. Remember, recovery does not always mean feeling perfect immediately. Fatigue can linger for some time, even after other symptoms improve. Be patient with yourself. Gradually return to normal activities instead of rushing back into a busy routine. Healing is a process, and every person's body moves at its own pace. Most importantly, never ignore how you feel. If something seems unusual or worse than expected, reach out to a healthcare provider. Your health deserves attention and respect. Take the time you need to rest, recover, and rebuild your strength. And please share this information with someone who may need reassurance today, because understanding treatment is the first step toward calm, confident healing. As we come to the end of this conversation, I want you to take a slow, deep breath and remember something very important. Knowledge is not meant to scare you, it is meant to protect you. Illness can feel frightening, especially when symptoms appear suddenly and your body feels unfamiliar or weak. But most of the time, with the right care and attention, your body is incredibly capable of healing itself. You are not fragile. You are not helpless. Your immune system works day and night to defend you, often without you even noticing. The key is to listen to it, respect it, and support it. If you ever start to feel unwell, do not panic, but also do not ignore the signs. pay attention with calm awareness. Rest when your body asks for rest. Drink fluids when you feel drained. Seek medical advice when something feels more serious than usual. There is strength in asking for help, and there is wisdom in acting early. I have seen many patients recover fully simply because they responded quickly and cared for themselves properly. At the same time, I have seen complications happen when people tried to push through and pretend everything was fine. Please do not treat your health as something secondary. Your energy, your ability to work, to care for your family, to enjoy simple daily moments, all depend on this one body. Protecting it is one of the greatest responsibilities you have. And remember, you are not alone. Millions of people experience this illness every year and recover safely. The difference often lies in awareness and timely action. Let this information empower you, not overwhelm you. Talk to your loved ones about what you have learned. Encourage children and older family members to be careful during high-risk seasons. Create a home environment where health is taken seriously but without fear. Small daily habits truly make a big impact over time. If this discussion helped you understand your body better, I gently encourage you to share it with someone who might need reassurance today. Sometimes one conversation can prevent unnecessary suffering. Continue to stay informed, continue to ask questions, and continue to respect your body's signals. Your health journey is ongoing, and every step you take toward awareness makes you stronger. Thank you for taking the time to learn and care about your well-being. Stay safe, stay mindful, and most importantly, stay kind to yourself.